at KTVU.
Well, Carrie Fisher died, as we know, after suffering a massive heart attack on board a flight. She never recovered from that heart attack.
And yesterday it was also revealed that Zsa Zsa Gabor died December 10th as a result of a heart attack.
According to the Centers for Disease Control, heart disease is the #1 killer of women in the United States. For more on these stories, we're joined by Dr. Misra of U.S. HealthWorks. Thank you for joining us again, Dr.
Morning,
Misra.
Doctor.
Thanks for having me.
When we talk about heart attacks and heart disease, I think of people like my dad, older, male, not me.
Yeah.
These stories remind us that it could be us.
Oh, sure, yes. So it is, as you cited, the CDC, it's the #1 killer of across the board of all-cause mortality, and it gets overlooked because we tend to sometimes identify gender with a particular disorder, and you're right to say that, and we just need to be more informed, and these are good resources to that end.
One of the statistics that really stood out to me, also from the CDC, they said almost 2/3 of women who die suddenly from heart disease had no previous symptoms, and that seems to be in keeping with what Carrie Fisher's family has come out and said, that this really was unexpected.
It's a tough one because often the first sign of disease in the vascular bed, cardiovascular bed, is that of a heart attack or a stroke perhaps. And yes, there isn't a lot of clues or hints or warnings. Often it is a very fast-moving condition that can be like that. And unfortunately, in her case, she's on a flight, and that was even more challenging because it's a time-sensitive matter too.
So knowing that, what do we do about it?
Well, I mean, the moment you're in a situation that you have even a thought of something on those lines, you have to get immediately in touch with a medical professional who can assess the situation, because it may not be that. And those are things where all sorts of factors go into that evaluation: vital signs, clinical exam, and labs and things like that, which support or disprove that diagnosis.
Can you explain the difference between sudden cardiac arrest and heart attack? Because I know we keep talking about heart attack, but for some reason I always think they're the same, but they're not.
Well, a heart attack is really what happens when a coronary artery gets occluded, and depending on which one, it can depend on how severe or devastating the heart attack itself might be, many people survive. Heart attacks aren't always fatal. Sudden cardiac death, just to make an analogy of one, in sports, for example, if a person takes a shot right to the chest, it can put the heart into a bad rhythm, which can result in sudden cardiac death. And if it hits it just at the right part of the EKG, the electrical impulses. So that's where the heart automatically that's it. Wow. That's a bit different than a vascular problem.
What about the importance of just having a good night's sleep? Maybe not living a stressful life. And a lot of us, we live stressful lives. You know, a lot of women, especially in the Bay Area, are working. Parents, and we're all...
Yeah, well, we're all burning the candle both ends, right. It seems like, men and women. And I would say that I would reference the great work from the Blue Zones. I don't know if you're familiar with it, which cites 6 qualities of the centennials, those who on average crossed age 100 more than any other places in the world. And they center around that. Constant moderate physical activity, having a good social family life and engagement, plant-based diet. These are all things which help take the sting out of stress to some degree in different ways. We're all different. We all respond to stress differently too. So.
And Doctor, we were talking earlier in the break room, one of the surefire ways to prevent, or best ways to prevent having some of these heart health problems, it's common sense, it's exercise, but it's simpler than a solution than you could think.
Yeah, actually, the American College of Sports Medicine, my subspecialty, sports medicine, recently came out with this, and it got corroborated by the evidence that 150 minutes of cardiovascular exercise a week, 2.5 hours, is what you need for preventative measures towards cardiovascular bad outcomes, such as strokes or heart attacks.
Both men and women.
Correct. Yeah, and that can be achieved all in one bulk, 150 in a day, or 150 divided up over a couple days. I personally do it over 2 days, 75 minutes a day, twice back-to-back days in a week. So this is very important, and it's been corroborated also by other international sports medicine organizations as to the best preventative interventions towards bad outcomes like, again, stroke or heart attack. Stroke is the #1 reason people get admitted to the nursing home. So these are not good things, and once they've incurred once, the mortality is very bad in the 5-year window then thereafter.
Okay. Well, you've certainly brought it to light, as unfortunately have these very high-profile deaths. Dr. Misra, thank you for joining us, and a Happy New Year.